opens your eye and make, you can see from the examples I'm presenting to all of you before your screen, you can see how it has really damaged the cornea of this patient. And if left for long and becomes chronic, it can lead to irreversible vision loss, something that cannot be reversed. The next one that we need to look at is a viral keratitis. Viral keratitis. Now, this one too is really dangerous. It's something we must not joke with. Sometimes our lifestyle can really expose us to this particular virus. Why? Because if you look at the species that are responsible for viral keratitis, you have herpes simplex virus, that's HSV. Then we equally have the virus. Now, these viruses are not viruses that we should take for granted. Like the HSV is sexually transmitted, especially once there's a skin-to-skin contact. So if you have a man out there or a woman out there that gallivants or jumping from place to place, you are just playing around with this HSV. VZV, that's varicella zoster, is another virus that you pick up. This particular virus is equally responsible for chicken pox. We call it the alpha herpes. Another name, we call it alpha herpes. And it's responsible for a condition we refer to as shingles. It can be spread from close contact. So these particular viruses are not viruses you should take for granted. Once you are a patient that comes constantly in contact with these viruses, then you are putting yourself in danger, especially your eyes, because they are linked to viral keratitis. Now, let's look at the next one, which is fungal. I'm sure a lot of you are familiar with this type of eyes. You will see this a lot in the north. You won't blame them. There has lots of dust because they are either in the Sahel or Sudan Savannah region of Nigeria, where you see they have high pressure wind, especially from the Sahara Desert. So you find this wind that envelopes that part of the north. And the wind, to be candid, from research, it has shown clearly that some of the pathogens that are responsible for fungal keratitis are associated with this dust. A good example is one particular genus we call Fusarium. We have other genuses there. We have Aspergillus and we have Candida. Now, these particular fungal pathogens can cause debilitating fungal keratitis. And there are so many other species. For those who do medical mycology, they will tell you other species like Fusarium solani, Fusarium petroliphyllum. Pardon me, I just have to give you the lecture. We equally have Fusarium keratoplasticum. Don't attempt to pronounce them so that you don't bite your tongue. It requires training. Then we equally have other species of Aspergillus that can be responsible for fungal keratitis. Good examples are, the reason why I'm mentioning this, I know we have academics in our midst, and I'm sure they will appreciate some of these species because some of them will want to do further research on them. For Aspergillus, we have Aspergillus flavus, we have Aspergillus fumigatus, we have Aspergillus denutans. So these are some of the species we have. that are responsible for fungal keratitis. Just like I said, they are really associated with organic matters like the soil, and they are found often with dust. So there is really need for us to, protect our eyes, especially now that we are approaching the Harmattan season, where we have more of the northeasterly wind coming from the Sahara Desert. The rainy season is gone with the southwesterly wind. So we have more of this northeast trades wind coming in. So we need to protect our eye. And don't forget, this is the season when we do have conjunctivitis, Apollo. So please, this lecture is coming in handy so that we begin to protect ourselves early enough. Then there's another type of keratitis we call keratitis. This one is a parasite. It's caused by a microscopic organism called Acanthamoeba. Acanthamoeba. We have two particular species for those who do parasitology. We have two species that are linked to this particular eye infection. Now, if you look at the eye before you, I'm sure you are not happy. Somebody having this type of amoebic eye problem is not going to be very comfortable. Two known species are Acanthamoeba castellani, and the second one is Acanthamoeba polyphaga. Now, for academics, they will need that. Now, but for others, one thing we know is that this particular one, they are linked with even people who wear contact lenses, those who wear glasses, contact lenses. Why? Because your ophthalmologist will equally advise you on how long you keep it and how well you protect it. Then those who wear contact lenses while swimming, they are equally prone to this amoebic infection. So this particular one, too, just like you are saying, it attacks the cornea, leading to eye pain, redness, blurred vision, and you find the person being extra sensitive to light. Now, it is our ophthalmologist that will tell you which of these keratitis you've picked up, especially those who have any of this condition. You cannot just say it at face value. It has to be examined, diagnosed properly for the medical personnel to now come up with a final verdict as respect to the type. Now, what causes keratitis? Going by the lecture I've just given, you can tell that bacterial, fungal, parasitic, and viruses are responsible for these different types of keratitis. Then we have non-infectious causes too. These ones include injuries to your eye, maybe from a fight, could be from an accident, could be from anything. It could be something entering your eyes, and then as a result of that, now predisposes you to any of these other type. Then the wearing of contact lenses for too long. So we advise that when you don't need it, please pull it off your eyes. We've always been saying this, that please try as much as possible to avoid staying in the sun for too long. Please, please, we don't want you to get too much of this ultraviolet radiation. It's not going to be good for your health. Then as much as possible, if you know your diet is lacking in vitamin E, try and see how best you can help yourself. Then those with immune diseases are equally. Now, some of the signs we see for keratitis are: one, already you've seen how reddish the eyes all became, irritated, some bloodshot. The eyes are often watery, painful. Some patients complain of blurred vision, and so many others like that. They run away from lights, and so many like that. So these are some of the signs and symptoms of keratitis. Let's move straight to pterygium. We call it the suffer's eye. The suffer's eye. Now, one thing with this particular one is you remember when we were looking at the conjunctivitis, our first lecture on the eye disease. We told you about this particular region of the eye. But here, we are still looking at the conjunctivitis, but in a different manner, where you are now seeing a growth, an abnormal growth of the conjunctiva. Now, almost with some blood tissues passing through your cornea to your iris, to your pupil. No, then that means something is wrong. Something is wrong. As a normal eye is not meant to have this kind of growth. If you look at the two diagrams before you, you are going to see a normal eye with a normal conjunctiva. Then you see the one that you now find an abnormal growth of the conjunctiva moving across the cornea through the iris, almost hitting the pupil. Now, there are so many factors that can be responsible. So let's look at these different types. We have different types of pterygium, and we grade them. We have grade 1 pterygium. Now, what is grade 1 pterygium? Now, grade 1 is, if you look at the eyes, the diagram before you, if you look at the conjunctiva moving across the cornea, for grade 1 pterygium, the growth grows over the white part, that's the cornea, and into the iris. So if you look at the diagram, you see these growths moving into the iris. If you look at A, you look at B, especially the A and B, if you see them, the first two at the top, on top. If you are looking at my diagram, the first two on top, you can see how the conjunctiva, even with the blood vessels, you can see the blood vessels showing in the conjunctiva, how they have moved across the cornea, the white part, and now they are hitting your iris. So people with this type, once we see this growth and the movement of the conjunctiva, we can tell a grade 1. Now let's look at a grade 2. For a grade 2 type of pterygium, you'll find the conjunctiva, it has moved into the iris proper. It has moved into the iris and halfway into the pupil. Look at the grade 2 in your diagram there. You can see it has moved across, it has crossed the cornea, it has crossed the iris, and it's almost halfway to your pupil. So you can imagine a patient with this kind of eye condition. Definitely this kind of patient will not be comfortable because vision will be blurred. Vision will be blurred. Now for a grade 3, looking at the diagram before you are going to see a grade 3. A grade 3, let's look at, for grade 3, it has grown across your iris into the pupil. It has grown across your iris into the pupil. And for grade 4, it has even covered your pupil and crossed your pupil. So you'll find these different types. The one that is just around the cornea, grade 1. The one that has crossed the cornea and is halfway into the iris, grade 2. The one that has entered the iris proper, grade 3. And the one that has even crossed, the one that is in the pupil, grade 3. It's in the pupil, it has crossed the iris into the pupil. And for grade 4, it has even crossed the pupil. So at this stage, you find the patient having difficulty seeing. So this is exactly what we see in patients with pterygium. Please, I want to reiterate this fact that those with pterygium, it is an abnormal growth of the conjunctiva, leaving its normal position, crossing the cornea into your iris and crossing even as far as your pupil. So we see this a lot with patients in northern Nigeria. If you go to northern Nigeria, we see these two there. And even across Nigeria, there's a high incidence of pterygium. Now, let's look at some of the causes. One, for pterygium, we will strongly advise that you should stay off ultraviolet radiations from the sun. This one is a major reason why people have pterygium. Please do as much as you can. Stay off high ultraviolet radiation. Our weather will soon be, as soon as we're done with the harmattan season, we'll be entering a very hot and dry season before the rains come. So while we are battling with wind and dust, we equally will be battling with excessive heat. So all of these are predisposing causes for this particular eye condition. Don't forget again, the more one gets older in age, the more one's eyes too needs to be taken care of. Why? Because as we grow older, our eyes can be caught napping with any of these eye diseases. Don't forget, I told you earlier about the need for us to ensure we supplement our diet with vitamin A's so that our eyes can be in constant good condition. Then please, for those who gallivant, who go about, men who jump from one woman to another, even when you have your wives at home, beautiful women at home, I would strongly advise you to stop it. If you're a woman and you leave your handsome husband at home and you're jumping from one man to another, please stop it, because if you're exposed to this human papilloma virus, you may just be joking with several sexually transmitted infections in addition to battling with eye problems. So what do we see with pterygium? Just like we have said earlier, the eyes will still be red, it will be dry, and in some cases, some are watery, itching, some the eyes are really burning. The patient finds it very difficult to see, and the patient sometimes is very, very uncomfortable. Even when the doctors, the ophthalmologists recommend contact lens for them, they find it very difficult. It's always discomforting each time they put it on. So a lot of things like that do occur with pterygium. At this point, I want to pause because I know you've all been wonderful listeners. I want to invite my friend and brother, Famchilaka, to take it up from here so that we get to see diagnosis and tests for these two conditions. Hello, Fam, are you with us? Hello, Fam.
Yes, sir.
Okay, please, you have the floor. Take it up from here. Thank you very much. Hello, Fam. Fam Chilak, are you with us? Hello, Fam. Hello, is Dr. Chooks with us?
I think Dr. Chooks. Doc, I saw him. I don't know whether network is favorable on his side. Okay. The farm is on board.
Should I go on, sir?
Yes,
go on.
Okay. All right. Thank you very much, sir. Good evening, everybody. Thank you for having me again this evening. So I will just run straight quickly to the treatment and then diagnosis for keratitis and pterygium. Of course, enlightened us rather on the cause of keratitis. Okay, which is a very important eye disease that we should take note of. Okay, so quickly, how do you diagnose keratitis? Yes, another one. How is keratitis diagnosed? Firstly, is that the ophthalmologist, of course, would want to probe the patient. All right. The essence of the probing is to streamline the diagnosis. All right. Doctor, please, I am I am trying to alight from a bus. I don't know. Can you give me just 5 or 10 minutes and let me just get myself out of this place, please?
Okay, thank you, Farm.
Please, thank you, sir.
Can we, Dr. Chus? I think I saw Dr. Chus. Please, I don't know if network is favorable on your side. Please just weigh in. Dr. Chus is a WHO a medical analyst. He is the one that really headed other consultants in coming up with a Super Life Health Therapeutic Manual. He is the lead medical consultant that he's the head of the team. So we are privileged to have him tonight so that he can now do more justice on how plant-based stem cell therapy can really how God has used it, given us that. So Dr. Chus, please, can you unmute yourself and take the floor?
Good evening. Thank Dr. King.
Doc, you're welcome.
Thank you very much. Dr. Egbe, thank you for your lecture.
Thank you very much.
I think just to contribute, there is a condition we also refer to as piquencula. Piquencula is almost like this pterygium, but the difference is that in piquencula you have yellow growths, unlike a red growth. So it's peculiarly endemic in some part of northern Nigeria. In WHO report. Well, some of all these eye conditions, most of
Yeah, sorry.
so some of this eye issue. Can you hear me?
Yes, we can hear you now.
Yeah, some of these eye issues. Some of them are treated easily by medical intervention. Where Superlife comes in, because if you look at the cases on board, we talk about keratitis, we talk about pterygium, and the one I just mentioned, piquencula, they can be medically treated. Even they can pass through minor surgeries, minor eye surgeries to get rid of them. Then the use of Superlife products like the SNC, Superlife Neuron Care, is used as an adjuvant to support medical treatment. The role of the Superlife product is to prevent a relapse or a reoccurrence, and is to prevent permanent damage to the eye, because some cases after medical intervention there might be some injuries or damage. So the role of Superlife is to prevent that damage, and if there are damages, is to correct damages, provided it's not damage that has just damaged the eye. So we have some conditions that we made mention of in the manual, like the first eye topic people talk about. I remember you talk about conjunctivitis. We made mention of it in the manual, and we talked about the product administration. So if you watch, most of them are almost presenting with the same signs and symptoms. So that is what we said in the writing of that manual. You may not practically see every. Are we here?
Yeah, go ahead, sir.
So you may not practically see every name of a disease condition, but some that are not, you didn't see the name. The ones that are there have the same similar presentation, the same signs and symptoms, some similar causative organisms. So the same product apply. Like we have keratoconea. Keratoconea is in the manual. We have keratomalacia, like what Dr. Rowe was trying to say just now, deficiency of retinol, that is vitamin A. Deficiency of vitamin A predisposes one to keratomalacia, and which is a risk factor for this eye condition. We also have xerophthalmia, which is a dryness of the cornea. Is also a risk factor, and it's in the manual. We also have iritis or uveitis, which are corneal disease problem. They are also in the manual, and they are all having the same presentation with this pterygium, keratitis, and piquencula. So that's what we're talking about. So since they have the same presentation, the same symptoms and signs, some having the same causative organisms, is the same approach in the treatment using SNC. Then in protracted cases, we add ST30 as stem cell therapy alongside with the neuron care therapy. Why we use neuron care for eye treatment is because of the supply from the brain, because the brain controls the supply to the eye, the nerve supply to the eye, especially the optic nerves. So, and we see some of these disease conditions, they damage that optic nerves, and that predisposes one to this blindness, partial blindness, or damages the eye physiognomically. So why we use SNC is to, facilitate the connection, the functionality of the brain and the eye as far as supply is concerned. And so when there are messages, no shunting of message from the brain to the eye, there will be good function of the eye. So that's what we're talking about. So as I said, after medical intervention, there might be a disconnect from the brain, and the person may still be having challenge. Just like you see some, they will tell them they will meet cornea. They will just go cornea specialists. Amongst ophthalmologists, they are cornea specialists. They are cornea specialists who does only work on the cornea. It's not all ophthalmologists that can temper the cornea. So when they do some of these surgeries, minor or major, they inflict injury that may not be visible at that instant, but it starts showing itself after some time. So that is where Superlife comes in to get rid of such. Either it regenerates what have been damaged, or it corrects what have been damaged, or it rebuilds another one entirely. Then it potentiates the one that are there to aid eye functionality. So we have materials in the Superlife Neuron Care that are particularly of high advantage in eye treatment. For example, in the SNC, we have the lutein and the zeaxanthin. They are two antioxidants and protein in nature that are particularly stationed in the eye. They help to mop out radicals in the eye. They help to mop out causative organisms in the eye by impeding on their pathophysiology. You know, when I say impeding, if you stop the reproductive process of an organism in initiating an infection, you are able to stop the infection. So that is what SNC do. So that lutein and zeaxanthin is a very potent antioxidant there in the eye. So, and we have the marigold. The marigold is also in SNC, and that marigold is a potent supplier of lutein and zeaxanthin. Then we also have the mental spicata, that is the spearmint. The SNC, what the spearmint does, the spearmint helps in perfect neuronal supply from the brain to the eye. It helps in second messenger. It aids or facilitates the function of second messengers, which the brain produces, and they function in the eye. So we also have that one as part of our constituent of our XNC. Then the SNC also have the bee berry. The bee berry extract, and that is the Vaccinium mytalum. So the bee berry extract is part of the SNC. The bee berry is replete with retinol that Dr. Rose was talking about. Retinol, that is vitamin A. And the bee berry is also replete with beta carotenoid or beta carotene. And we know that beta carotene is a precursor of vitamin A, and it particularly plays a very active role in the functionality of the eye. And you know, some of this infection that comes to the eye, if the eye has a high concentration of vitamin A, it helps as a preventive house to the eye. So you may not come down with such infection. You know, during this period of dust and wind, it's not everybody that come down with Apollo, or that Apollo, that's conjunctivitis. Why? So people don't come down with it, even when in the same house with some people that are suffering it, others don't come down with it. So they have high immune resistance to that because of substances like vitamin A, beta carotene in the eye that Life product ahead of seasonal problems like this. It prevents you from getting infected. Then if you're already infected, it will facilitate your recovery alongside with the medical intervention, because we don't do away with medical intervention, especially with eye conditions. Some first line of action is medical.
Hello, I think Dr. Chu's network has has been logged out, and thank God that at least today is far, far better than the previous. We really heard him clearly, and with his reference point on the manual that is before us. So the manual that God have used him and the other team of consultants to have delivered to Super Life, you and I that are already members of Super Life, please, I will want to encourage us to always make that manual available, more especially to your clients or your family members. Let them go through it, because that prevention, being on a preventive side, is far more better and is far more cheaper. The kind of eye conditions I'm hearing, I started seeing since two weeks ago, that Dr. Rolf has been really doing a holistic lecture on it, or workshop on it. It's a big eye-opening. And knowing fully well that God has given us a solution via Super Life ecosystem. In short, I am super excited, much more super excited to be part of this wonderful organization, that I should carry this campaign to my entire family members, to my friends, and extended people out there. So let them see what this nature has given to us. So the SNC and STC30 are the chief major solution of this. I don't know, Doc. Dr. Rove, I think Dr. Chus has really weighed in. I know that Pharmacist Chilaka, I know that today might not be other chance, apart from the network issue. We have our Congress going on. So I think maybe we will ask Coach Sampson to please use the few minutes to do the needful on just in the next 15, 20 minutes. Let him just, the new people that are joining the Zoom meeting tonight, that want to identify with this wonderful company, what they can do to connect to our company directly, so that the issue of somebody reselling our product to you is a wrong approach. You need to come to the company directly as a customer and begin to get these products, number one, the original products, and at the company discounted price. Nobody should not come and begin to resell or either give you a fake product that is in all the looks and crying in Nigeria. Coach Sampson, are you there? Hello, Coach Sampson. Please. Hello, Sampson. Okay. So it's like he too. That's his network too. So please, we want to appreciate Dr. Ebe, who has been the lead team in this every Friday workshop. He is the lead person in this workshop. So, Dr. Arup, please, thank you very much. I know that God will help us to really, really appreciate, both in cash and in kind, this wonderful sacrifice. And I know to humanity. So thank you very much. Pharmacist Chinaka, oh my God. These are the people that God gave us during the September 7 of our celebration of plant-based stem cell technology. These are the first-hand people that really came up on a panelist and do justice to this wonderful ecosystem. So thank you very much. And Dr. Chuks, the lead consultant, that have really taken their time to take all our active ingredients to their lab. That is World Health Organization, WHO. They took all our active ingredients to their lab and seriously scrutinized it and discover not only that all these active ingredients is fully present, they are fully present in the real percentage proportion that our company prescribed. So since then, he really waded into this wonderful manual that we have today. So, Samson, please, if you are there, let me know. Coach Samson. So, please, okay. So now, the definition of our super life implies, super health. That's the one that Dr. Ube and Dr. Chuks and Dr. Chinaka has really handled in a very wonderful way. Then the second part of it is super wealth. Super life, super health plus super wealth is equal to super life. So I want to bring our attention here. We're not going to do much on that, just to summarize the packages. If you want to identify whether you want to use our products for yourself or for the other. Samson, are you there?
Yeah, good evening.
Yeah, please. We have been waiting for you. Just summarize the stuff.
Okay. The complan.
Yes.
Okay. Good evening, everyone. Thank you for listening to the wonderful presentation by our doctors and our farm too, that the network was unable to allow him to address us properly tonight. Like you all know, Super Life is all about super health and super wealth. That is the meaning of Super Life. So, and the first segment is all about super health, which is about our health. And the common adage is always saying health is wealth.
Hello, Coach Samson. Wow, network.
And Dollar King, you continue from there now.
Okay. So he's back.
So based on that, we say health is wealth. So for those of us that are coming to our Zoom meeting tonight for the first time, maybe somebody invited you to be part of it for your health or for your wealth. I want to actually congratulate you, and the best way to go about it is to be part of this ecosystem
in which you can enjoy both the super health and the super wealth. So quickly, we want to quickly explain how you can be part of this wonderful opportunity. And so I will quickly summarize all our packages in which you can choose from any one of them to either treat any medical challenges or be part of the partners of Super Life by promoting this wonderful product for your loved ones and for your neighbors and people around you, so that they can be beneficiary of this God-given wonderful opportunity. So we have 4 packages, which is a super. We call it the family package, which consists of 20 packs of our flagship product and our stem cell product, which has been enhanced to meet the new challenges. To meet the new challenges in the system, and this goes for 902,000. So you can get 20 pack of Super Life SCC30. That is a super package. This consists of 20 wonderful products that will get results and changing life worldwide. Then second one, we have the Supreme package, which is a pack of 8 of the same enhanced SCC30. Though you can choose any of our products if there is need, based on your recommendation. For somebody for tonight, the basic recommendation was SCC30 SNC, so you can choose it on the package. The only difference is that the price will be there will be little difference in the amount of the price based on the other product features of the other product. So the Supreme, all this I'm giving you is based on our enhanced Super Life S30. So you can go for the Supreme, which is 8 pack, which is 348,700. Then you can go for start package, which is 2 pack. We call it trial package, starter pack, trial pack, because SCC30 means the trial of minimum of 30 days for a trial period. If you are a doubting Thomas, or maybe somebody that due to so many circumstances you have been use several products that has not given you the required or expected results, so you can try our product, the start package trial for 30 days, and I'm very sure the trial of 30 days will surely convince you to really know that this is a best way to go. Then the little beginning, which is startup, I don't normally like to talk about it because I don't recommend one product. So I don't. It's only for those that want to do their maintenance. If you want to choose start, you can go for one pack. But because it's part of our package, because if you go to our ecosystem, you're going to find that's why we talked about it. So then the privilege package, which is not, I call it privilege package, is not meant for every Super Life member worldwide. It's only meant for Nigerian ecosystem. It's a privilege for us. That's why some of us, we don't value what we have, particularly in this part of the world, particularly in our country. As much as we have several challenges, but we are a blessed country with so many, opportunities in diverse ways. So Super Life, even considering the ecosystem of Super Life operating over 50 countries and 6 continents, we are still privileged to have the lowest package in terms of conversion. When you convert to Naira, our package is the cheapest, one of the, if not the cheapest throughout the world. I'm telling you, even our neighboring country here, they pay more to get all this package I mentioned before. Then this promo super is solely for our system in Nigeria. So because that is, if you go to other systems, you might not find it there. So that is why I didn't mention it earlier, just for you to know that it's a privilege package. That if you don't have money for the family package, you can go for the promo super, which is half package, of the product of 10. So 10 and it is half money. So that will goes for 451,000 naira. And these are the packages we have in Super Life. So you can choose your package depending on your need or your recommendation, depending on what you want to use our product to achieve or to use for. So that is it. So like I said, and this will give you a privilege to become part of the ecosystem in which you can get our product directly from the company without any intermediary. So, or except from our, what do you call it? Our offices, recognized members or registered members or distributors in Nigeria, particularly our 3 directors in Nigeria. You can get the product directly from there because, and this is very, very important. Make sure you get your products from the right source so that you'll be sure of what you are getting. Anything outside the system, we cannot guarantee. And the Superlife will not be liable for anyone that gets his product outside the system. Whatever happens to you, we are not liable. But if you get our products through our system, we are very sure that you will definitely get a positive result. Not only that one, Superlife product carries $1 million liability, product liability. So that is, and so that's how sure the Superlife is about their product. They place $1 million product liability on it. And I'm telling you, the exceptions, nobody has able to prove them otherwise. So that's why it is important to note this. So there are so many other advantages, being a part of the system. But because of our time, I might not elaborate on them. So as you come, the best way is to choose any of the package and be part of the system so that if you even want to use it for your health, you can be able to get the subsequent products at a discounted price. Not only that one, you can avail your opportunity to support you, like 80-20% golden rule. So we support all our partners, that come through our system in whatever way you might need assistance. We're ready to support you in any way so that you can get because our goal is for you to achieve your desired result, which is to get your health back on track. So for those that are interested in becoming a sole distributor or major distributor of our product, then after registration, you can start promoting our product, our products, your company to other people. And there's a lot of benefit that comes with this. You can earn an additional income, about 8 ways to earn by promoting, just by sharing the good news about our product. And you have a lot to benefit from this. These are the what we call 8 ways I think, I don't know if I can quickly just talk about them in 5 minutes. We have the sponsor bonus, which means that we call it connecting profit. Just telling people about the good news, inviting your members or tell them, your neighbors or whoever you know that has any challenge or that wanted to, upgrade their health, that wanted to optimize their health. That is the word, optimize their health. You can just tell them about this and you get what we call a sponsor bonus. Then we have binary, which is we call power of 2. Having 2 people, one on your left and one on your right. You started earning daily. The first one is instantly. Then we have key bonus, which is also instant. We have the compressed level roller bonus, which is also instant. Then we have compressed level matching bonus, which is monthly. This is the leverage system. Then we have compressed level bonus, which is also a leverage system. Then we have program crown boot bonus. Global crown boot bonus. And lastly, we have the retail profit, which is that these are all the benefits, for part of this system and also promote the company. So that is at least for because of our time, I won't dwell much on it. And there's a good news also that we have there's a lot of adjustment to our level bonus. Now, currently, before, if you repurchase, because as I told you, when you become a partner, maybe you want to use the product for yourself or for your family members or what have you, you can repurchase at the discounted price. That's what we call repurchase. And previously, you don't benefit anything than the discount in price. There is no point that accrued to you directly. But now there is a new, development in every bonus in which you can earn personal bonus of about 15% of whatever you purchase, apart from the normal discount you are going to get from the product